dripping off. Just kind of have to tug at it. And then you have this spike, is what we call it, to spike the bag. It's not like super sharp like a needle or anything, but it's plastic. It's sharp enough to kind of pierce the bag here. And then what you'll want to do is kind of let the fluid go through the line so you're not injecting air into her skin. So I just kind of let gravity be my friend. And once you see some fluid dripping out, these are your clamps. So make sure you clamp it before and after, or after you give it, because yeah. Okay. We've had clients that forget to clamp it, and then they come home and like their counter's covered in fluid.
Oh my gosh.
So remember to do that. And then you attach your needle obviously to the end here. And these are just 18 gauge needles. They're kind of large, so just be very careful not to poke yourself because it'll hurt. But they're clean. And the dogs don't seem to mind it too much. And you'll just take this little thing off. I'll put this first. And you'll see that this just twists on there. The fluids on her, usually we try to go in an area that she has a lot of extra skin. So usually that's going to be up in her shoulder area. And usually what I'll try to do is, she's got a nice part to her fur right now. Just try to visualize the skin so you know where you're going. And I usually like make a little tent like out of it, and I want to go take my needle into the tent here. You don't want to poke directly in. You don't want to poke like accidentally like through the skin or anything like that. So that's why I try to make kind of like a tent out of the skin and just kind of go in there. Obviously not trying to poke my fingers or anything. And see, she didn't seem to mind. And it's not like, you know, you're not, it should feel pretty smooth when you're going in. If you feel like you're getting into like dense tissue or anything, I'd be worried you're in a muscle.
Yeah.
So just, you know, be mindful of that. But it feels pretty good.
Unclamp it.
Unclamp. Then she'll start getting fluids. And I would say, you know, most dogs tolerate it just fine. Yeah, if you're able to hold it in there. Keep it like in a place where, you know, it doesn't have, don't make it hot or anything, but keep it at like room temperature. Make sure it doesn't get too cold, because they do know, like they can feel it, you know, when it's too cold. And then I just start pushing here, and you'll just kind of watch this. Make sure it looks like it's got a good, you know, a good flow on here. And you can squeeze the bag to make it go by.
Are bubbles a problem?
Nope, bubbles are okay. Little bubbles are okay for subcutaneous fluids.
Are you squeezing that bag?
I mean, I don't know. Not very.
Okay.
Just enough to give it some pressure. And you'll notice, like, right now I feel like I might be getting a little bit of resistance, so I'm wondering if it's... Yeah, she's getting a little hump there.
Is it supposed to have a little bubble or something?
She'll start developing a little bubble where the fluid is.
And that's normal?
Yep, that's normal. It'll absorb. There, now I'm getting a good flow there. Sometimes you might just have to kind of move it around a little bit in there. And a muscle. And like I said, it doesn't have to be exact, just guesstimate that you're getting about 200 in there.
So we're looking for when that level gets down to the 2 there.
Yeah, and I mean, these bags are overfilled a little bit too.
Yeah, it's fatter in the middle, obviously.
Right. So I'm gonna probably go down to like maybe try and get it to like that 1.5. Slides there, and then this one's like has like a little wheel.
Oh, there are 2 clamps?
Yep, there's 2 clamps. That one and this one.
What does the slide one do? How does that work?
This one you just put it into the, like push it.
It narrows the...
Yeah, it narrows the line.
Oh, I see.
And then this one just clamps it. Try and get a little which way you go it.
Okay.
so I think that's okay to start.
And then you only use that needle once.
Correct. Only use that needle once. I put a couple extra in there, so if it does need to be, if you know, poke through, poke yourself on accident, you can.
You see that again?
I'll put my finger here just to, because sometimes it'll leak a little bit. Just a little pressure. Sometimes a little bit of water will ooze out. Sometimes it'll look a little bloody, but I mean you've poked into their skin, so that's not alarming. And then when you're doing your needle at home, what I usually tell clients to do is, like, say you're on the counter or something, rest this on the counter and just slide this in, and then put it on that way. That way you're minimizing the risks of, like, you accidentally poking yourself after it's been in your dog.
Yeah.
Yeah.
And I would just leave this one on, is what I usually do. And then when it's time to give more, you change it. That way you're not thinking, did I change that or not? Just change it right before you give it every time. And then we clamped it here, so we should be good there. We're not leaking. And the other thing is that sometimes they can develop some sensitivity. Hopefully we're not doing this, like, you know, forever, but they can develop sensitivity and scar tissue, you know, if you keep going in the same spot. So maybe try to switch sides, maybe move up a little, move down a little. Oh, yeah, it's just got a little blood there.
Give it tissue.
Yeah.
No.
And
I've got something in the car. I don't. Okay.
So she said put a little hydrogen peroxide on it. And
Yeah, when you get home, if it, like, once it dries up, you put a little squirt in it, it should just dissolve it away.
so we don't need a Band-Aid or anything in her
No,
fur.
no Band-Aid or anything.
Okay.
You wanna